Hello everyone, this is Carrie Anderson. Hope you all doing well. In today's video, I'll be talking about children's health symptoms you should not ignore. So if you like the video related to my health, my way, I would like to request you all please do subscribe the channel, hit the bell icon or give thumbs up so that I will come up with more and more videos with lots and lots of information. So here we begin, let's go. When children experience unexpected symptoms, they are most often normal and not a cause for concern. However, some signs may point to a larger issue. For a little extra help, add the following symptoms to your parental radar. You might need to bring your child to the doctor if they persist. Lack of response to loud sound. Newborn and babies can't tell you if they are not hearing correctly. They also don't respond to every stimulus the way we would expect. If you notice that your child is not bothered by or doesn't respond to loud sound, make an appointment with your pediatrician to check for hearing problem. Many but not all states require newborn hearing screening. Now, I'll be talking about the hearing loss. As children get older and are introduced to personal music devices, loud stereos, video game television, and even noisy city streets, their hearing may be at risk. According to the Center for Disease Control and Prevention, about 12.5% trusted source of children ages 6 to 19 have permanent hearing damage due to exposure to loud noise. Help keep noise at safe level. When children are listening with headphones, never set the sound above half volume. The same goes for television, video games, and movies. Limit time spent around loud noise as much as possible. Trouble focusing. Babies can't tell you if their vision is blurry or if they can't focus their eyes, but there are subtle ways you can tell. If your baby never seems to focus on object and they have a hard time finding close object like your face or hand, let your pediatrician know. Watch for signs in school-age children like squinting, difficulty reading, or sitting too close to the TV. If your children is not performing well in class, make sure to ask if they can see the blackboard. Many children are labeled poor student or disruptive or are even diagnosed with ADHD when they actually have identified poor vision. Constant eye rubbing is another sign of potential vision problem. High fever and severe headache. Kids often run a fever due to illness like stomach viruses and minor infection. When a high fever is accompanied by a headache so severe that your child has a hard time keeping their eyes open, that's a sign of a bigger problem. See your pediatrician right away to rule out a more serious conditions such as meningitis. If untreated, meningitis can cause significant complication and in severe cases even death. Your pediatrician can order tests to help determine what causing your children's symptoms and offer the most appropriate treatment. Now I'll be talking about abdominal pain. Stomach ache may seem common for some kids, especially as they work through new diet, try new food, or have the occasional junk food overload. Pain in the abdomen may signal a more serious issue if you notice an extra level of discomfort in your child, such as abdominal pain in the lower right side, vomiting, diarrhea, stomach tenderness when touched. For example, this type of abdominal pain could signal a condition such as appendicitis. The key difference between appendicitis and a stomach virus is that in appendicitis, the stomach pain worsens over time. Now I'll be talking about the extreme fatigue. Extreme fatigue is a symptom that should not be ignored. If your children show symptoms of fatigue or doesn't seem to have their usual energy for an extended period of time, talk to your pediatrician. Extreme fatigue can help several different causes. Don't discount these complaints as symptoms of late night or adolescence. Your pediatrician may investigate a range of possibilities, including anemia, malabsorption syndrome, and depression. It's important, particularly with teenagers, to give your child the option of speaking with their doctor without you in the room. Your child and an older child especially may feel more comfortable talking about specific medical or social issues with their doctor independently. Now I'll be talking about the breathing issues. According to the CDC, more than 8% trusted source of children in the United States have asthma. Telltale signs include trouble breathing when playing or exercising, a whistling sound when exhaling, shortness of breath, or difficulty recovering from a respiratory infection. Treatment doesn't cure asthma, but it does help minimize symptoms or stop asthma attack when they occur. If you notice your children is having breathing problem, talk to your pediatrician. Now I'll be talking about the weight loss. Unexplained weight loss can be a concerning symptom. Slight fluctuation in a child weight are generally normal, but dramatic and otherwise unintended weight loss could be a sign of a problem. If you notice a sudden unexplained drop in your children weight, it's important to see their pediatrician. Let them know about the weight loss issue as soon as possible. They can ask your child question and other tests to look for the reason for the weight loss. Extreme thirst. Hours spent running and playing games call for adequate hydration. Extreme thirst is another thing altogether. If you notice that your child has an insatiable need to drink water or can't seem to satisfy their thirst, see their pediatrician. Constant thirst can be a sign of an underlying health condition such as diabetes. According to the American Diabetes Association, about 1.25 million children and adults in the United States live with type 1 diabetes. It's more commonly diagnosed in children and young adults than older people. Excess thirst is just one symptom of type 1 diabetes. Another symptoms include increased urination, extreme hunger, weight loss, and fatigue. If any of these symptoms are present, make an appointment for your child to see their pediatrician. The takeaway: routine doctor visits are an important part of making sure your child stays healthy. But even if your child is not due for a checkup, it's important that they see their pediatrician if they experience unexpected and potentially serious symptoms. Getting early treatment for a new health condition can make a big difference. Diagnosing and treating the condition can help prevent future complications. It can also potentially help your child to start feeling better sooner. So that's all about the diabetes or your child symptoms in this video. I hope you all got it. So that's all about the content in this video. I hope you all liked it. For all of you, I prepared a small presentation that will be going to share in the description box below. You can check it out from there. So before signing off, I would like to request you all, please do like, share, subscribe this video with your loved one so that they will get to know better. So this is Carrie Anderson signing off. Please stay connected for my upcoming video with my another content. Till then, God bless you. Bye bye and take care.